Good afternoon, Virgin Islanders. This afternoon I come to you with grave concern and a heavy heart. And I need your help in assisting us to once again get through a time of crisis, not only for the U.S. Virgin Islands, but for the British Virgin Islands as well. As a Virgin Islander, as your governor, I take my job very seriously. Whether it's a regional leader or a global leader, I feel that ultimately we are all one people and we always must look out for our brothers. We did this during the pandemic when we opened our shores to anyone that could make it here, and we offered medical assistance to people as far away as the South Pacific. Right now, we are under full watch for what is going on in the British Virgin Islands. The current situation, ladies and gentlemen, is not good, and that's putting it lightly. As of last night, the British Virgin Islands reported having 1,559 active cases. I want you to pay close attention to that number, because the most active cases we have ever had in the Virgin Islands is around 200. And we are 3 times the size of the British Virgin Islands. In the last 24 hours, they've reported 3 deaths. And just like us, their hospitals and their infrastructure employees are affected. Over 100 of their hospital workers are either with COVID or quarantined because they may have been exposed to the virus. Their positivity rate for the last week and a half exceeds 17% compared to us in the Virgin Islands, which is at 3%, which is not that good either. We are doing everything we can to help the British Virgin Islands. Premier Foy, his cabinet, and all the people over there. I've been on the phone with the State Department. The delegate has been reaching out, trying to get assistance from DC for wherever we go. We are a foreign, they are a foreign port, and it makes it extremely difficult for us to send over any resources that we have. But we're constantly talking to FEMA, the CDC, the Health and Human Services, to see what assistance we can give our brothers and sisters over in the British Virgin Islands. We will continue to do everything we can to give as much support as we can to the British Virgin Islands. Up to this morning, I had the occasion to speak to Premier Foy, who remains concerned, but positive in terms of that they're going to be able to make it through with this. Preliminary reports say that they expect their active cases to get to as high as 5,000. So it's going to get a lot worse before it gets better. So we have to make sure that we are taking care of not only them, but ourselves. As they often say, when you're going to save somebody on the plane, put on your life vest first. Right now, our situation in the Virgin Islands is not optimal. And I know a lot of you have gotten used to having the virus and going about your regular business, not wearing your mask, not paying attention, hanging out in places with people. But we are against a new enemy now with this Delta variant. Although I cannot confirm that it is in the territory, I cannot imagine that it is not, with all that is what we're seeing going on in the BVI, as well as what is going on in the United States as non-vaccinated people continue to contract this variant. Currently, we have 5 people in the Wanaflui Hospital in St. Croix with COVID. That is high. We've had 2 deaths last week, and then in Snyder Regional here in St. Thomas, there are 7 people in the hospital with COVID. And 2 of those people are on ventilators. Not good as well. You know, we are not exempt from what's going on in the British Virgin Islands to happen here. The big difference is we are blessed with resources that they don't have. Resources like the ability to hire contracted EMTs and respiratory therapists and have them here now for over a year and a half to support any kind of surge that they have. We have the resources of a 50-bed highly infectious diseases unit at Schneider Regional to take our patients if we have any. We also have the experience of a year and a half of dealing with COVID and the deadly effects of it. Remember, we have learned how to manage this thing through a lot of hard lessons. What we want to make sure is that you are taking advantage of every opportunity to get vaccinated. You know, of all these people that are sick and people who have passed away, none of them have been vaccinated people. We want to make sure that we know what we're doing. As good old people say, when your neighbor house is on fire, throw water on yours. So we're pleading with you to make sure that you're doing the right things to secure you and your family and your community from this virus. Wearing your mask, remembering to social distance, washing your hands continuously, and perhaps most importantly, getting your vaccine. Getting your vaccine is something that if you do now, it will still take 2 to 3 weeks for you to build up the antibodies. So don't wait. Go out today and get vaccinated. Currently, we have over 82,000 doses have been administered in the territory, and we're about 57.6% of our vaccinated population that are eligible for vaccine. Our population that's eligible for vaccine have gotten at least 1 dose, and 47% of our population has gotten 2 doses of the vaccine. Please go out and get your vaccine and get yourself secured. However, of the ties we have with our British family, whether you're Smith like my family, O'Neill or Turnbull, you know, the friends we have, we are one people, but we have to protect the Virgin Islands and the people who are coming and going from the U.S. Virgin Islands to our British brothers and sisters. Effective Monday, anyone entering the U.S. Virgin Islands from the British Virgin Islands will have to submit a test, negative test, within 24 hours of departure. I'll say it again. Anyone traveling from the British Virgin Islands to the U.S. Virgin Islands will have to submit a test within 48 hours of departure. That's negative. We are still accepting the positive antibody tests, as we are doing in all of our regular portals from travel from other places. But we're going to be taking extra caution, and please don't try to game the system. We've already made 1 arrest, and we'll make others for people trying to forge their way into the U.S. Virgin Islands. I will say, anybody that makes it to our shores are eligible for a free vaccine, and they're eligible for any care that we have. I mean, we're fortunate to have the monoclonal antibody treatment, which the British Virgin Islands doesn't have. One of the things we're working on trying to get them that resource. That's the treatment you get if you go to the hospital and you have not been vaccinated. We're able to give you that, and it helps your body immediately produce antibodies and fight against COVID. It's not 100%, and you still have to get the vaccine after you have that monoclonal antibody, because it only lasts about 2 or 3 weeks. Our ferry load coming from the British Virgin Islands, we thought seriously about reducing that load, but we thought better of it because all the people who are coming should have had a test within 48 hours of their departure. A lot of people have called me and tried to say, well, now is our chance to get even with the British Virgin Islands for what they do to our sailors or our fishermen. Now is not the time for that. Now is the time to be responsible as citizens, global citizens, to our community, friends, and family over in the BVI. So I'm asking the people who are coming over, whether on water taxis or whatever, captains, we will arrest you. If you don't have a negative COVID test, please do not enter our waters. We are not playing. report to customs as you're supposed to do, and we'll have personnel there to check you for the portal. For travelers who are going over to the BVI, our suggestion to you is stay safe. If you're vaccinated, that's one thing, and if you are vaccinated in the territory, we should have the operations up where you can get verified very soon, but we're not encouraging people to go over to that situation. From the beginning of this pandemic, March 20th last year when we declared the emergency, we have always said, our goal is not to eliminate COVID. It's impossible. You cannot stop COVID from spreading. Our goal is to manage it and to make sure that our hospitals and our health resources are available to people who get sick. We have 7 people in the hospital already in St. Thomas, and over 120 cases today active in the Virgin Islands. We gotta work to drive that down. We gotta work to get that to under 50 for the entire territory. Please, I'm asking you, I'm begging you for your cooperation so that we can continue to enjoy the prosperity that we've had because we've managed the crisis well. Not just me, not just health, not just Vitima, but us as a community managing to get through. Let us all take some time today, whatever religion you are, to pray for our brothers and sisters in the British Virgin Islands. It is not an easy thing to deal with. Let us pray for their leadership. They would have the wisdom and the discernment to guide their people through this most difficult time. And let us pray that we as Virgin Islanders who have the benefit of these resources can learn to appreciate that, get vaccinated, stay away from mass gatherings, wear your mask, and wash your hands profusely. I thank you for joining me in this and spreading the word that we need to support our brothers and sisters and make sure that we stay safe. Stay safe, stay sanitized. Love you.